Hello, my friends. This is Tassif here. You can see behind me, it's a very beautiful place. You can see a body of water, and you can see that I am actually at a resort. And this is the kind of place where people come and they feel happy. They feel like, they can have a good time. But let me tell you, although I'm in a very nice environment right now, and it's a beautiful evening, but let me tell you that I'm actually very, very worried. And the reason for that is I saw a very serious news update that our country is suffering because of drug shortages. Shortages of drugs that are life-saving drugs, prescription drugs, and my friends, let me tell you, and I'm sure you know this already. Our country has an aging population. Our country has an aging population. So as time goes by, there will be more and more senior citizens, which means that the demand for prescription medications and all different kinds of drugs will likely increase. And obviously, our country has many health challenges, right? There are people in our country who are suffering because of cancer and so many other different kinds of diseases and illnesses. And so, if we want to ensure that people have access to good treatment, that people are able to fight diseases and fight illnesses and get back to good health, if we want to make sure that people stay well and they can have a productive life and good quality of life, then we need to make sure that there is no shortage of drugs. But what's going on is, according to a report, there are 323 active drug shortages in the country right now. And this is as of the first quarter. This is as of the first quarter of the year. So, the first quarter of 2024, 323 active drug shortages. Now, this is the highest number that has ever been recorded since people started tracking the data. And previously in 2014, there were 320 active drug shortages. So now it's 323, and this is the highest that we have seen. So this makes me very worried. And if you know anything about me, if you watched my videos before, if you know a little bit about my biography, then you know that I am a healthcare policy analyst by training. And what that means is, I study all aspects of healthcare policy pertaining to, how we can ensure access to good healthcare services at a cost that people can afford, and high quality services, not just any healthcare services. So high quality services at a cost, access to high quality services at a cost that people can afford. So cost, access, quality. So these are the most important factors whenever we talk about healthcare. And so as a healthcare policy analyst, I am really dedicated to helping ensure that people understand how to navigate the healthcare system and that they are able to receive the kind of care that they need. So I am just one person in a country of 330 million, approximately 330 million people. But I'm just sharing with you my thoughts. And when I saw this news update, I became really worried. And I don't know how many people know about this. Obviously, it's in the news, but I'm not sure, in the haste and hurry of life, how many people, what percent of the population in our country actually know that this is a problem. So some of the drugs that are where there are shortages are actually chemotherapy drugs and emergency medications. So really life-saving drugs. And so, my friends, this is something that I'm going to be closely monitoring going forward. And so please stay connected to my channel, because I'll be sharing with you more updates on this issue. But I wanted you to know that in addition to all the problems that we're facing, border crisis, um, you know, uh, global conflicts, and inflation and supply chain issues. In addition to all those problems, this is another problem that we are facing. And so I'll be bringing you more information. So please stay connected with me. And thank you so much. Subscribe to my channel. I would appreciate that very much. Thanks.